I'm Katarina Penrith. This is the Griffith Vet Clinic where I'm doing my studies. This is subject ACM GAS301A. Today we're going to have a chat and show you a couple things here at the clinic in a way we deal with contagious diseases. I'm Katarina Penrith. So today this is the subject of ACM GAS301A. So today we are going to be going through a few contagious diseases here that we go through at work. We do have a patient coming in shortly that is a cat. So they actually have come with to us that this cat has a ringworm. Which is a contagious disease. So the ringworm is easily spread to other animals. So this cat will have to be put into our isolation ward. There'll be steps that we will need to take to get this cat into our isolation ward. There'll be re-popping on our proper PPE, our gloves, a different shirt, and then that shirt will have to be washed separately and disinfected away from any other laundry that may be there in the laundry as well. Another thing is dogs, or mainly happens in puppies, has parvovirus. So that is a big common disease that is easily contracted to other animals that haven't been immunised before or had immunisation in general, especially against kennel cough, parvovirus and all their other injections. Our normal routine that if we do have a dog that has parvovirus, they will stay in their car out the front of our office. We will go out dressed in our PPE, our gloves, and make sure that the animal doesn't leave the car at that time. We will perform a CPV and a CCV test, which is one of these kits. It's simple. In here we have some fluid. In here, and this is the cotton tip of what we pop into the anal area of the dog. We swish it around, we pop this into this liquid, and then we put the cap on straight away and we let the dog stay in the car until we do our test. Once we get back inside and we have taken off all our protective wear, all our gloves, everything that has come off, we will then put on a new set of gloves, another shirt, just in case, because we don't want to bring it back into the office. We will then test it on this Antigen Rapid Ag Test. So this is just like a little square container, and it has positive or negative. So it's a CPV positive or negative, or a CCV positive or negative. And I will show you, this is what the tests should look like. So if there is a reading where the dog is contagious with parvovirus, and it comes up that they do have that, that's CPV, so that's canine parvovirus, and that's CPV. And CCV is the canine coronavirus. So they're both contagious and they can affect other animals. Floors will need to be mopped once we bring that dog into isolation ward. Clothes will need to be changed. They will have to be set up onto a drip. They will have to have medication. They will have to be monitored. Their symptoms are, it does happen a lot in pups. So their symptoms are vomiting off their food, not drinking, blood in the stool, lethargic, weak, and some worst case scenarios, their gums do get pale. That's if it is left untreated for a long time. So parvovirus, we find, is a really big thing here in our area, and that's due to not vaccination. People should be vaccinating their animals. Some choose not to. It's easily picked up, it's easily spread, so we have to take extra precautions that our other patients that are here are not getting exposed to this virus, especially if they haven't had their injections, or if for anything they're another person's animal, so we would be reliable. So a lot of steps are taken in for this. Ringworms are another disease that's easily spread, and that's just not from being wormed properly or within the time that you're supposed to do it, monthly, 3 monthly, 6 monthly, year, depending what you end up getting, what medication you get for him, how old the cat is and whatnot. So this cat that's coming in today has not been wormed in over 2 years. It has gotten into a cat fight with another cat. It has been going missing a lot through the week over the last month, and it's come back and it has loss of hair. The skin is dry. It's fallen out completely, which means there is a severe case of ringworm that has spread through this cat. He will be looking at staying here for at least a week to 2 weeks until the hair at least starts to grow back, because it's just got to the point that the disease has just spreaded so bad on this cat that he is just molting. Not molting because he's losing hair, but he's losing his hair due to the infection, due to this ringworm that has been left untreated and unwormed. So we will get him on some fluids. We will start administering him some medication that we can help treat this and get him back to being healthy. We're also going to have a chat to the owners about putting this cat on a regular worm tablet, which is what should be done. So I'm going to take you now for a walk through. I'll show you our isolation room. I'll show you where the cages are kept. I will show you the things that we have in our isolation ward that cannot leave the isolation ward. So everything in that isolation ward, any sort of materials that you use, any sort of PPE that you're wearing on the day or whatever you're doing that day, cannot leave that room. So if you're going to be in there with this cat or a parvovirus puppy, you need to take everything off. There's a washing basket in there, so you'll take everything off. You will leave it there in the basket until the end of this patient's stay, and that's when you do a full clean. So everything has to be F10, down to the drip line, down to your trolley, down to the floors, the walls, everything. Everything has to be sterilized and F10. So I'll just take you for a little rough look around of what we do when we do have to isolate a patient. Floors, wherever you walk after treating a contagious animal, needs to be mopped with F10. Any door handles that you may touch needs to be sprayed with F10. Anything you do needs to be sprayed with F10. Everything has to be re-sterilized after. But, you know, if you take the precautions as you're supposed to, wearing your gloves, wearing a different shirt, like this is my work shirt today, but I will have another work shirt that I'll have to put on just to cover me. So I'm working for the rest of the day and I can't have a contaminated shirt. So I'll just take you for a run through now and we'll go from there. So this is our isolation ward. I'm going to get this cage ready for the cat to come in so we can pop him straight into isolation. As you can see, we have our own sink for washing up. We also have all our cleaning stuff, our F10, our washing basket where we put our soiled clothes, the cat litter that is designated for just isolation room, and then all the stuff that we need here. We will have to go and get the line set up, but we'll do that further on. First we'll line it with some newspaper. We will then place down a towel and a cat litter for him. This will be the patient's med chart. So this is where all the observations will be done, physical exams will be noted, progress notes of the cat throughout the day. It will be kept on in here on its cage. we'll get a clipboard and we'll organise it to pop it there. That way we can see what medication's been administered, what his observations are like, how his hair's going, what treatment is working or not working, eating, drinking, going to the toilet. Everything has to go in here, and then after that we will put it into our system, into the patient's file. So here we have the perfect PPE. So we have our own caution when mop bucket here, so if we need to clean anything, if there's been any spillages, this just stays here and doesn't leave this room. The door must be always shut when we're in here. Always must be wearing gloves, must wear a different shirt, so then when this gets soiled, it will then go into that basket. I have my protective shoes on and my long pants. Nothing is exposed. I have long sleeves as well, so I am fully protected. Once I'm done here, I will dispose of my gloves, my shirt, and I will spray myself down with F10 and then give the floors a mop with F10 if need be, if there's been any spills from the animal or anything like that. It's okay. It's okay. You'll be okay. You'll be okay. So Kerry's come into our care now. We have collected him from the front. We have placed him in here. We're just getting the vet onto putting in a catheter, so we can start giving him fluids and treating him with some medication via IV. Just going to get some water for the cat. Should always be provided with water, even if it is going on the drip. We'll give it some dry biscuits as well. See if we can try and get it to eat something, so we'll pop this in their room and we'll go from there, and hopefully they'll start to eat something and have a bit of water. They will be put on a drip anyway. This is F10, so we're just cleaning all its bowls and the sink. We'll let that sit for 10-20 minutes, then we'll come back and scrub it. So ringworm is contagious. It can affect other people in the house or other pets in the house. It is a fungus infection. It happens anywhere around the ears or the nose, forelimbs, or any part of the body. It's red, itchy and scaly, and like this patient here has got a pretty bad case of ringworm. He's only 1 year old. We will be treating this patient orally and topically by with antifungal medication for helping to get rid of this ringworm. You will always need to wash your hands after you handle the cat, even if you are at home and they have a ringworm, or the bedding will have to be washed. Toys, any grooming products, brushes, utensils that you may use, their feeding bowl, they'll all need to be washed every time they are being handled. We can prevent ringworms and any other nasty things with other worms is by treating them orally, or you can use the serum on the back of their neck. There is products such as Advocate that does Allwormer. There's other brands out there like Frontline as well.